Hi, welcome to Dr. Medics. Female reproductive system ovary. Female reproductive system has gonads or primary sex organs. The female has two ovaries. The ovaries have two functions: gametogenic and endocrine. Gametogenic has the production and the release of ovum or egg, which is called the female gamete. The endocrine has the secretion of female sex organs. Functional anatomy of ovary. Ovaries are flattened ovoid bodies with the length of 4 cm, width of 2 cm, and thickness of 1 cm. Each ovaries are attached at the hilum, hilum to broad ligament by means of meso-ovarian and ovarian ligament. Each ovaries have two parts, which is medulla cortex. Medulla is also known as zona vasculosa. Medulla is the central part of the ovary, which is deeper in portion. It has stroma of loose connective tissues and contains blood vessels, lymph and nerve fibers and bundle of smooth muscles near the hilum. Cortex. Cortex is the outer border portion with compact cellular layers interrupted at the hilum, where the medulla continues with the meso-ovarium. Cortex is lined by the germinal epithelium. Under this germinal epithelium, a fibrous layer which is known as the tunica albuginea. Cortex has three layers, that is, one is the glandular structures, second is the connective tissue cells, third is the interstitial cells. The glandular structures represent the ovarian follicles at different stage, and the interstitial cells as a cluster of epithelial cells with the fine lipid granules formed mainly from the theca interna cells. Once again, I'll repeat all these things. The interstitial cells has cluster of epithelial cells with the fine lipid granules formed mainly from the theca interna cells. This is ovarian follicle. In intrauterine life, the outer part of the cortex contains the germinal epithelium derived from the germinal ridges. When the fetus develops, the germinal epithelium gives rise to the primordial ova, gives rise to the number of primordial ova. These move towards the inner substance of the cortex. On the other hand, layer of spindle cells of granulosa cells from the ovarian stroma surround the ova. A layer of spindle of granulosa cells from the ovarian stroma surround the ova. So these two are called the primordial follicle. So at the 7th and 8th month of the intrauterine life, about 6 million primordial follicles found in the ovary. At birth, there will be a 1 million primordial follicles seen in the both ovaries. Rest of the follicles degenerate. At puberty, the number decreases to about 3 lakh to 4 lakh. So after menarche, during every menstrual cycle, one of the follicles mature and releases the ovum. During every menstrual cycle, only one ovum is released from any of either of the ovaries. During every menstrual cycle, many of the follicles degenerate. The degeneration of follicles are called the atresia. Occurs at all levels of follicles. The degenerated follicles, which is known as the atretic follicles, become fibrous, and fibrotic follicles are called the corpus fibrosa. Degenerated follicles, which is also known as the atretic follicle, become fibrous, and the fibrotic follicles are called the corpus fibrosa. The degenerated follicles disappear without leaving any scar. Functions of ovary. Secretion of female sex organs that is estrogen and progesterone also produces inhibin, relaxin, and androgen. Oogenesis and menstrual cycle are the other two functions of the ovaries. Source of secretion: ceca internal cells of ovarian follicle, corpus luteum or adrenal cortex, androgen and placenta. Ceca internal cells of ovarian follicles, which is produced in large quantities, estrogen produced in large quantities. Corpus luteum or adrenal cortex, estrogen produced in smaller quantities. In androgen, the estrogen derived from androgen, androstenedione, which is secreted in the theca interna cells, migrates from theca interna cells to granulosa cells, which converted into estrogen by an enzyme called aromatase. And in placenta, the estrogen is secreted. The placenta will occur in the pregnant woman. Functions of estrogen. The major function of estrogen is to promote the cellular proliferation and tissue growth. The main function of the estrogen is to promote the cellular proliferation and tissue growth in sexual organs and in other tissues related to the reproduction. In childhood, secreted in small amount. Which is secreted in small amount? Estrogen. During puberty, the estrogen secretion increases sharply, resulting in the changes in sexual organs that are called as the effects of estrogen. There are 9 effects of estrogen in the sexual organs, that are in the ovarian follicle, in the uterus, in the fallopian tubes, in the vagina, and the secondary sexual characters. The sixth one is in the breast, seventh one in the bones, and the eighth one in the metabolism, and 9 electrolyte balance. First one is the effects on ovarian follicles. The estrogen promotes the growth of ovarian follicles by increasing the proliferation of follicular cells and thus increases the secretory activity of the ceca interna cells. The second one is the effects on uterus. The estrogen produced changes in the uterus. The first one is the enlarged uterus, double of its childhood size by the proliferation of endometrial cells. Second one is the increased blood supply in the endometrium. Third one is the deposition of glycogen and fats in the endometrium. All the changes mostly happen in the endometrium in the uterus. So fourth one is the proliferation and dilatation of the blood vessels in the endometrium. So fifth one changes is the proliferation and dilatation of endometrial glands become tortuous and with increased blood flow. The sixth one is the increased spontaneous activity that causes the uterine muscles and sensitivity to the oxytocin. So the seventh one is the spontaneous activity as the contractility of the uterine muscles. All these changes prepare uterus for the pregnancy. Third one is the effects on fallopian tube. So the estrogen acts on the mucosal lining of the fallopian tube. Mucosal lining of the fallopian tube by increases the number and size of the epithelial cells, especially the ciliated epithelial cells present in the fallopian tube, which is the lining of the fallopian tube. This increases the activity of the cilia. This increases the activity of the cilia to facilitate the movement for the ovum in the fallopian tube and enhances the proliferation of glandular tissues in the fallopian tube. All these changes for the fertilization of ovum for the pregnancy. Fourth one is the effects on vagina. Effects on vagina. The estrogen changes the vaginal epithelium from cuboidal to stratified type. Cuboidal to stratified type. Increased resistance to the trauma and infection. Second changes occurs in the vaginal epithelium where the layers get proliferated. The pH of the vagina changes into the which increases the acidic in nature. All these changes necessary to prevent the infection. The most common infection is the gonorrheal vaginitis. These probably cured by the administration of estrogen. Effect on secondary sexual characters. Estrogen is responsible for the secondary sexual characters. The first one is the hair distribution, which develops in the pubic region, axilla, and in females, pubic hair is the base of a triangle upwards. Body hair growth is less. The scalp hair grows profusely. Skin becomes soft, smooth, and vascularity increases. The body shape, there will be a changes in the body shape. Shoulders become narrow, hip broader, thighs converge, arms diverge, fat deposition, breast and butt increases. Changes in the pelvis. Broadening of the pelvis width increases the transverse diameter, round or oval shape of pelvis. Pelvic outlet is oval shape of pelvis. The voice larynx remains in prepubertal stage which produces high pitched voice. Sixth one is the effect on breast. Estrogen causes development of stromal tissues of the breast, growth of an extensive ductal system, deposition of fat in the ductal system. These prepare the breast for lactation. Estrogen causes development of lobules and alveoli in breast. Progesterone is necessary for the fully growth of breast. Prolactin is necessary for its function. Seventh one, effects on bones. Estrogen increases the osteoblastic activity. At time of puberty, growth rate increases enormously, but at same time, estrogen causes early fusion of epiphyses with the shaft. At older age, estrogen not segregated or scanty, which causes the osteoporosis, which is the bone becomes weak and fragile, causes the fracture. So eighth one is the effect on metabolism. On protein metabolism, estrogen induces the anabolism of protein, which increases the total body protein. On fat metabolism, estrogen causes the deposition of fat in subcutaneous tissues, breast, butts, and thighs. Overall, specific gravity of a female body is considerably lesser than the male because of the fat deposition. Ninth one is the effect on electrolyte balance. Estrogen causes the sodium and water retention from the renal tubules. These process is normally significant, but in pregnancy becomes more significant. Mode of action of estrogen. Estrogen receptors situated on the nuclear membrane of target cells. These target cells are of two types: alpha estrogen receptors and beta estrogen receptors. Alpha estrogen receptors present in the uterus, liver, heart, kidneys, and beta estrogen receptors present in ovaries and other tissues. Estrogen acts through genes. Regulation of estrogen secretion. Estrogen secretion is regulated by the anterior pituitary, which is released from the FSH, which is the follicle stimulating hormone, stimulated by the GnRH, gonadotropin releasing hormone secreted from the hypothalamus. Theca cells and granulosa cells acts on the FSH receptors after binding with the receptors. The FSH receptor acts via CAMP, stimulate the secretory activities, the theca cells and the granulosa cells. Estrogen inhibits the secretion of FSH and GnRH by the negative feedback mechanism. Inhibin secreted by granulosa cells, which increases the estrogen secretion by inhibiting the secretion of FSH and GnRH. Progesterone, source of secretion. In non-pregnant women, small quantities secreted by the theca cells during the first half of the menses, that is follicular stage. Large quantity increases secreted during the later half of the menses, that is during the luteal phase, by the corpus luteum. Adrenal cortex secretes small quantity also. In pregnant women, large quantity secreted by the corpus luteum in the first trimester. In second trimester, the corpus luteum degenerates. Placenta secretes large amount in the second trimester. Transportation occurs in blood by plasma proteins, albumin and globulin. Metabolism, progesterone secreted with a few minutes degraded the other steroids. No progesterone effect. Degradation occurs in the liver. In degradation, the end product is pregnanediol conjugated with glucuronic acid excreted in the urine. Functions of progesterone. The progesterone's function is the final preparation of uterus for pregnancy and the breast for lactation. Functions of progesterone. There are 8 functions that affects on the female sex organs. The first one is the fallopian tube and the uterus, cervix, mammillary glands, hypothalamus, thermogenic effects, respiration, electrolyte balance. Effects on fallopian tube. Progesterone promotes the secretory activities to the mucosal lining in the fallopian tube. The secretory activities are necessary for the nutrition of a fertilized ovum before the implantation. Effect on uterus. Progesterone promotes the secretory activity in the uterine endometrium during the secretory phase of the menses. Uterus prepared for the implantation for the fertilized ovum. Progesterone increases the thickness of the endometrium by increasing the number and size of the cells. The thickness is 1 mm at the beginning of the secretory phase and 5 to 6 mm at the end of the secretory phase. Increases the size of uterine glands, become more tortuous. Increases the secretory activities of epithelial cells in the uterine glands. Increases the deposition of lipid and glycogen stromal cells of the endometrium. Increases the blood supply in the endometrium due to the blood supply in the endometrium increases in the size of vessels, vasodilatation occurs. Decreases the frequency of uterine contraction during the pregnancy, cause expulsion of because expulsion of implanted ovum prevented. Effect on cervix. Progesterone increases thickness of the cervix mucosa. These process inhibits the transport of the sperm to the uterus, and these process used in the contraceptive actions of mini pills. Effect on mammary glands. Progesterone promotes development of lobules and alveoli in the mammary glands by proliferating and enlarging the alveolar cells. Progesterone in breast, secretory in nature, swollen by increasing the secretory activity and fluid accumulation in the subcutaneous tissue. Effect on hypothalamus. Progesterone inhibits the release of LH from the hypothalamus through the feedback mechanism. These processes utilized in the contraceptive action. Thermogenic effect is unknown, but the progesterone increases the body temperature after ovulation. These process is not known, but suggested that the progesterone increases the body temperature by acting on the hypothalamic centers on the temperature regulation. Effect on respiration. During luteal phase of menstrual cycle and pregnancy, the progesterone increases the ventilation via respiratory centers. These process decreases the partial pressure of CO2 in alveoli. Effects on electrolyte balance. Progesterone increases the reabsorption of sodium and water from the renal tubules. If a large amount in this process, if large dose has occurred, excretion occurs. Due to the due to this process, indirect effect of progesterone combines with the same receptors which bind with the aldosterone. These aldosterone blocks the action leading to the excretion of sodium and the water. Mode of action of progesterone. Progesterone receptors situated in the nuclear membrane of target cell. Progesterone receptors of A progesterone receptor and B progesterone receptor. Exact location not clear. Progesterone acts to the genes. Regulation of progesterone secretion. LH from the anterior pituitary activates the corpus luteum, secrete the progesterone. LH secretion influenced by the GnRH secreted in the hypothalamus. The progesterone inhibits the LH from anterior pituitary in the form of negative feedback.